The Intergovernmental Authority on Development, IGAD, through its Regional Pandemic Preparedness and Response Prepare project, has boosted Uganda with financial support of 14.4 billion shillings in the fight and management of Mpox and Ebola. The IGAD prepared team met the top management of the Ministry of Health to forge a way towards eliminating the deadly diseases in the country. Dr. Jane Cheng, the Minister for Health, noted that the financial support will boost and strengthen surveillance, laboratory capacity, workforce development and coordination mechanisms.
IGAD has been supporting Uganda, especially on cross-border issues during pandemics, and also supporting refugees, knowing very well that Uganda hosts a large number of refugees. And to date, we have nearly 1.8 million refugees in Uganda. So we want to say a big thank you to IGAD. I also want in a special way to appreciate IGAD for coming in a timely manner to support Uganda to respond to the current outbreaks of Mpox, Ebola, and many others that may come thereafter. Their timely response and flexibility in reprogramming and mobilizing resources, over $4 million to support Uganda's response, is deeply appreciated.
As there is flexibility in doing this project, and IGAD has discussed the flexibilities with the government of Uganda, it is important that we also focus on areas that we don't have to repeat with the next outbreak, and that is strengthening the resilience of our systems and the different components of our health system. So if that is done, then we don't have to repeat some investments as we continue to have other disease outbreaks.
IGAD Chief of Staff and Interim Director for Health, Mubarak Mobuya, noted that with comprehensive response plan, the project will effectively respond in a timely manner to save lives through a robust emergency and preparedness response system.
Benefiting from the support that has been put to our disposal by the World Bank through the Trust Fund for pandemics, through the program we call Prepare, which is pandemic preparedness and response, we've been able to mobilize up to $4 million to support the pandemic in the region, particularly starting with Uganda, where many cases have been reported. It's not lost on us that people are dying. It's not lost on us that the risk of this pandemic spreading is high, if not arrested. Therefore, we are happy to be here to support all the national efforts that are geared towards arresting this problem before it goes beyond the borders of Uganda. We are aware it has already crossed into Kenya and also South Sudan.
The resources are part of the committed $8.3 million allocated to support IGAD member states that are heavily impacted and grappling with the effects of Mpox disease, to reinforce member states' capacity to respond to current outbreaks and those in the future. Zahara Abigaba, UBC News.